Hello, and thank you for viewing ETSU Family Medicine's video on accountable care organization workflows. Today we will be discussing the screening of tobacco use and its intervention. This measure is looking at the percentage of patients aged 18 years and older who were screened for tobacco use one or more times within 24 months and who received cessation counseling intervention if identified as a tobacco user. The initial population is all patients aged 18 years and older seen for at least 2 visits or at least 1 preventative visit during the measurement period. The denominator equals initial population. The numerator is patients who were screened for tobacco use at least once within 24 months and who received tobacco cessation intervention if identified as a tobacco user. The only exclusions is if there is a documented medical reason for not screening the patient for tobacco use. Most of our patients already have a tobacco status documented due to meaningful use. However, the status has not been reassessed in several years. While triaging the patient, ask them what their current smoking status is. On the Problem tab, change the filter to Social History. If the correct status is there and has not been assessed in the past 24 months, click on the piece of paper to assess the problem. And as you can see with Ethan Test, this has not been assessed in quite some time, so we need to assess this former smoker because Ethan has said that he still does not smoke. He's a former smoker. So we click on the piece of paper and then we commit it. If a status is not listed at all, as is the case with Mitchell Test, we need to go ahead and add that. We can click on New at the bottom of the screen and add the current tobacco status. So we're going to say he's a current everyday smoker. And we are getting this because this is a test patient and we have suppressed and removed many problems on our test patients. You should not get this. We're going to click OK, and now it's added it to the chart. If the status listed is not correct, or if there are duplicate entries, please correct them as you find them. If the patient has been identified as a tobacco user, as in the case of Monaco Test, action is required. When placing orders in Allscripts, you will notice order groups. On the RX tab and the Instruct tab, you will see an order group called tobacco cessation. If you single click on it, this is going to give you a few suggestions on some things that you can order that will close the gap. If you are not able to see the order groups, you can click on the Off On button and then your folders will show up. Remember, the items that are in the folder are only suggestions. You can order anything that pertains. And as mentioned before, ordering a medication or tobacco cessation will close the gap for this measure. Thank you for viewing today's video, and have a wonderful day.